I'm Dr. Lucke-Wold, and I'm the speaker for today's webinar. The session will be for 30 minutes, followed by a question and answer session for 10 minutes. Please note down your questions and queries. You can ask me in the question and answer session at the end. So let's start with today's topic, psychedelic management for neurologic injury, emerging innovations. Just want to thank the sponsor. This webinar is sponsored by MDforLives.com. As you saw in the video, it's a premier healthcare market research firm. Medical doctors can register for free and become a part of this global community, take up surveys, participate in quizzes, and earn attractive honoraria. So sign up today. There will be links within the presentation. And without further ado, we will begin the presentation. So I will share my screen. Okay, so psychedelic management for neurologic injury, emerging innovations. We'll start by going into some of the neurologic injury mechanisms, and then we'll dive into the emerging treatments, going into detail. So a little bit about the neurotrauma, and I will unmute our host real quick. And so in terms of a neurotrauma, it can progress in terms of severity of injury. This can include loss of consciousness, changes in terms of Glasgow Coma Scale, ranging from very mild in terms of severity to more repetitive injury, which is classified as more moderate. We can see injury progression all the way from the subconcussion stage to the concussion level, and then to diffuse axonal injury as well. This can be a more severe component, often requiring hospitalizations, and we'll go into some of the details in terms of mechanisms of treatment. But this is a grading scale for overall severity of disease. Why is this important? This can lead to the effect of post-traumatic disorder. This can have behavioral features such as impulsivity and sleep disturbance. There can be very increased anxiety and emotional lability early on. Over time, this can proceed to more of this chronic feature. So this is more of the cognitive dissociation, lack of awareness in terms of overall confusion, this feeling as if in a fog. This can also manifest as behavioral features and physical features, which includes blurred vision, this vacant stare that can ultimately manifest in more severe etiologies such as convulsions and or seizures. In this late phase, you can either have this resolution of symptoms or this consistent post-concussion, which can overall advance to more of a chronic stage in terms of chronic traumatic encephalopathy. So what does this mean in terms of the pathophysiology? There you can see that there is increased disruption in terms of neurofibrillary tangles that develop. There's a disease that we have heard a lot about in terms of chronic traumatic encephalopathy for professional athletes and warfighters, but this manifests a more extensive disease where you can have behavioral and psychiatric features. Again, there can be delusions and severe depression, even suicidal ideation at this point. Cognition can be severely impaired at this point with disruptions in language processing. In terms of motor features, frequently ataxia, Parkinson-like syndrome, gait disturbances are very common. So there have been some emerging treatments in terms of really targeting some of the mechanisms, and we will dive into, in particularly psychedelics later on. But here's some of the other agents targeting oxidative stress and glutamate reactivity, looking at some of the channeling of these free radicals in terms of alternative treatment solutions. Another disease state that can present a severe neurologic injury is subarachnoid hemorrhage. This is primarily due to aneurysm rupture, and this can cause irritation to the brain, can cause severe neurologic decline. A lot of times, patients are coming in comatose. Interesting work has been shown in terms of this glymphatic system about clearance of blood products over time that can cause some of the changes as well. This can lead to deposition of fibrin, occlusion of some of these influx and efflux routes. There's increased activation of microglia, which is a target that psychedelics may potentially act upon that can promote this long-term effects. There's aquaporin 4 mislocalization, and this ultimately impairs water transport, leading to brain edema. The reason this is important is that that can contribute to vasospasm, delayed cerebral ischemia over time, that does not have great definitive treatment options, can contribute to severe debilitating headaches as well.